We've got an email from Pender County. It's a specific question. Says, I'm getting Medicare for the first time this year. What is the best way for me to compare prescription drug plans? Should I consult with my doctor to decide?
Well, actually, probably your physician is not going to be the knowledgeable source. The physician's the knowledgeable source of what he or she is prescribing. But in terms of a drug plan, I think if the emailer is familiar with the internet, certainly going to www.medicare.gov. You know, there is a link right on the front page to, it's called a prescription drug plan tool finder, where someone actually puts into this particular tool a list of all of their medications that they take and their dosages and the amounts. And Medicare has designed this wonderful computer-based tool where it will recommend the program. It will list out every program available in the state, but it will recommend the program that would be the least cost, including premium and co-payments, for the beneficiary. We have 47 different choices in the state for drug plans. Yeah. And why are there so many? Because no two of us have the exact same circumstance. And so because of that, you know, you really want to purchase a drug plan that meets your current needs, the drugs I'm taking today, and how can I access that medication, where I want to access it, meaning your choice of pharmacy, and then in the end, you know, have the peace of mind that I have a program that's really going to cover my needs for a year. And it doesn't always mean that one program is going to last the rest of your life, because certainly each and every year the premium changes on these plans, and the plans change the list of drugs that they actually cover each year, and that's very important. In fact, Medicare beneficiaries have received two really important pieces of information, if I may hold it up. Please. Everybody who is a Medicare beneficiary has received a Medicare & 2010 handbook. It's kind of like this is the health care program and how it works, but important, and especially to Stephanie's last point, if you hear of a drug plan that sounds so good and you don't see it in the back of your Medicare & handbook, that is the first sounding of the bell that something's a little fishy there, you know, in terms of that. But the other important piece for an already existing Medicare beneficiary enrolled in a drug plan is that they have received what's called the Annual Notice of Change. The Annual Notice of Change informs them what the premium will be in the next year. It will also inform them of what medications have been removed from the formulary, as well as what medications have been added to the formulary. And that's key information on whether or not someone needs to look for another plan. Obviously, if the medication my doctor feels is the best to address my particular, you know, health care situation, is no longer available, that tells me I got to go look for another plan, you know, that will cover that. So, you know, those pieces of information, as well as there's also, like I was saying, 35,000 people that have received a notice that their insurance plan has opted not to be available in North Carolina, and so they have to make another choice. And what's key about that is if they do not make the choice by January 31st, on February 1st, they're going to find that they'll be back on original Medicare and have no access to a drug plan. And so we are really promoting that message to not let the holidays, you know, confuse the issue. Now is the time to really research that and to begin looking for solutions so that healthcare coverage is ready on New Year's Eve for everybody.
Yes, good advice.